Lately, I've been opening up more and more about my struggle with depression. Sometimes it's been a silent struggle, and other times it's been things that I've talked openly about. The last couple of months have been pretty crazy for me with the move from Texas to California, to adjusting to new changes, having my daughters still in Texas, now having my stepson live with us for the first time. It's just been nuts. And it took me a while to really be able to take a step back and evaluate my mental and emotional health. And I finally realized that, wow, depression has once again taken over. And I found myself getting really, I don't know if the word's angry or discouraged, but I was upset that I was struggling with depression again, because I felt like I had a handle on it. And really, here's the thing is, people have bouts of sadness that come and go throughout their lives, and people who suffer from depression are going to have it come and go in life, and you're never going to get it all solved or all figured out for good. And so you have to give yourself some grace and really allow yourself to just exist and deal with what's going on instead of living in denial. And for me, it was very hard for me to grasp if I was depressed or not, because we all give a meaning or a definition to something. And as humans, that's something that we're wired to do, is to find some sort of explanation as to why something's happening. And that's why we're so good at rationalizing anything, whether good or bad. We can talk something out in our head and make it seem like it makes sense. And so we're always looking for a story. But for me, depression was something that has always been part of my life. And I didn't really have a name for it until I was, treated for it for the first time right after I had my daughter 19 years ago. And what depression for me became was hopelessness, wanting to die, wanting to end the feelings that I had in my head because they didn't feel normal or whatever. And so when I started to really make positive changes in my life and face the things that I'd been avoiding, and really take the time to really get to know myself, and that had to do with personal development, surrounding myself with positive people, going to seminars like Tony Robbins, Unleash the Power Within, Danny Johnson, different events that were meant to power your mind and empower you and help you find the best part of yourself and uncover that. So once I did all of that, I started to have purpose in my life, and I started having direction, and I started having those people in my life that actually made my life better. And so I really felt like, okay, I got this figured out. Like, I know what to do. I know to eat well, to, fill my mind with good things, to work out because that builds endorphins, and all these different things, meditate, journaling, all these different things. And for me, once I had that absence of suicidal thoughts, I just thought that I was fine. And so for me, the definition of depression meant wanting to die. And I haven't felt that way for years. And so in 2015, for many of you have been following my story and others haven't, in 2015, everything kind of just came to a head. All the stuff that I had been really diving deep into, my adoption, my trauma, all these different things. And it landed me to end up being in a mental health facility. And it was completely voluntary, but I spent a week in there. It was the best thing I could have ever done for myself. And it changed my life. And that's where I received a formal diagnosis about my mental illness by an actual psychiatrist. And I was prescribed medication that for the first time in almost 2 decades actually worked for me. And when I left that hospital, I vowed to continue my mental health journey. And so I stayed on my medication, and that led to me getting sober, because one thing that I learned through all of the deep therapy that I was in for that week stay as an inpatient, and then many weeks after as an outpatient, is that if you even consume one alcoholic beverage while you're on an antidepressant, it cuts the effectiveness of it. And so also some of the anxiety medicine that I was taking, that if mixed with alcohol could really intensify your state. And so I decided to quit drinking. And so all of these things were really great for me. I made those decisions, and then I kept on a certain path. And so I felt great, and I haven't wanted to like die in years. And that may sound so silly to some people, but for me, that was huge. Like, for the first time in my life, I didn't want to die. And so when I went to an event in San Jose, to one of the Tony Robbins Unleash the Power Within events, I accidentally forgot my depression meds. And I remember feeling completely terrified that it was going to ruin my whole weekend, because you have to understand, I've taken so many different antidepressants and anxiety meds over the years, and a lot of times they didn't work, or, different things happened. And I had horrible reactions and withdrawal symptoms when I went off. And I thought, oh my God, I'm going to mess up my life. Da, da, da. Well, guess what? While I was at this event, I felt great. I was in the right state. I was in the right environment. And I had mastered, for the most part, the coping skills that I'd been taught. I'd cut out the toxic people and the things in my life. And so when I returned home from that event, I elected to not start taking it again, because I felt fine. What happened was, gradually from November of 2016 until recently, the depression started coming back, and the things happened so gradually that I didn't even notice it, and my husband didn't even notice it. But what happened was, recently I made the decision and realized that I was suffering from depression, when I couldn't get out of bed, when I was crying all the time, when I felt hopeless and I felt worried about everything, and it was affecting my ability to live and be a good wife, mother, coach, friend, because I was becoming more and more withdrawn. I decided to go back on my antidepressants. I actually had about a little less than a month's supply left, and so within like 3 days, I noticed a huge difference. I noticed a huge difference in my mental and emotional state. I started talking to people more. I started getting more involved on social media, started not having such a hard time getting out of bed, not feeling so fatigued. And now I'm 18 days into taking this medication again, and I'm thinking so much more clearly. It's easier to get out of bed. Again, I'm not a morning person, never have been, but it's not such a struggle. I'm wanting to talk to people. And for me, it's been kind of crazy, because when I decided to get sober in October of 2015, I still remained fun and active and social. I just didn't drink. But then as the time has gone on, the last 2 years, I became more and more withdrawn. And I'll say that it was so confusing to me, because I didn't really associate that with depression, because like I said, I feel like depression equaled wanting to kill myself, and I didn't want to kill myself. So I kept questioning myself, like, oh my God, is it because I'm sober that I don't want to go places? Am I really introverted? Am I this? And now I'm looking at it clearly, and there was these signs of withdrawal. There was weekends where I would just stay in bed and watch Netflix all weekend long. And those aren't things that people even think about, because that's so normal now. People do that. They sit in bed and, Netflix and binge watch stuff, and they don't even realize that this, for me, was a sign of depression, not wanting to get out of bed, wanting to interact with people, not wanting to go anywhere, and all these certain different things happen. And so now that I'm thinking clearly, I'm like, wow, these were the signs of that depression taking over. And so I shared this with you guys, because sometimes we think these things are just normal because everybody else is dealing with it. But depression, there's a high rate of depression, and there's so many people out there who go untreated because they're not aware of the signs, because they think it's normal. Like I said, I didn't really think anything of it about me not really wanting to get out of bed and just watching like hours of Dexter or hours of different things on Netflix. But that's not who I am, and that's not who I am now. But I thought, well, people are doing that nowadays. It's not a big deal. And I didn't see that as a sign of just being completely unmotivated, completely unfocused, and completely a lack of drive, which for me, I've always had a huge drive. And all of a sudden I didn't. And so I just thought it was normal. But I share this because so many people out there go untreated. They have the symptoms and they don't realize it. Or there's people like me who've suffered from depression and then they get it fixed and then they go off the medication and then it happens again and they're embarrassed. Shame is a huge issue for people that prevents them. And so for me, when I was feeling, I was feeling lousy once I moved here, like I didn't really talk about it because I felt like embarrassed because here I moved to California for a better life, I thought, how stupid is it that I'm so upset that I left my girls? Like, duh, Mindy, you left your children, in Texas, even though it was a decision that was made, it was made together as a family, and it was what was best for Emily. She decided she wanted to stay with her dad. Haley was going to college anyways, but I just felt stupid talking about it because I'm like, why wouldn't I be upset? Like, why would people probably think I'm so stupid because did you think it was going to be easy? And that really just went back into like the fear of judgment, that shame. And then I finally decided to talk about it. And I'm so glad that I am now talking about it because it has connected me with other people who have similar stories, who've helped me through this, who give me encouragement, and I've actually encouraged other people. I grew up in a household where everything was like hush hush, sweep it under the rug. When I was first diagnosed it was diagnosed as postpartum depression after my daughter, I finally was like, oh my God, I'm not crazy. Like I'm not alone. This is normal. It's treatable. And I went and told my parents and they said, don't you dare tell anybody. If you do, you're going to get your child taken away from you. And it was just like, and I was like, just shocked that I didn't have the support, and it became something I was ashamed of. But I've learned now to be transparent, to talk about it, because that's where you gain strength and you gain support. But as I've been talking about this, I found out from a fellow Facebook friend that is a therapist about EMDR. And she said, if you were my patient, I would treat you via EMDR. And so I didn't know what it was, but I had made an appointment to start therapy. And when I started therapy and saw the first counselor, she asked, what do you want out of this? And that's one thing that I've learned through all of this journey to making me a better me, is to be very clear in what I want and setting boundaries and expectations and communicating that to people. And so I told the lady, I'm like, listen, I'm no stranger to counseling. I do all the things that I need to do. I meditate, I journal, I'm around positive people, I work out, I eat healthy, I know my self-worth, I know all these things. And I said, I've been in and out of therapy for over 10 years. I've been on and off different medications for 20 years. I'm like, I don't want to sit on a fucking couch any longer just talking about my problems, because although that is beneficial, I want a solution, something that will help, because as I have been on this journey, I've learned so much about the brain, the flight and flight mode, the prefrontal cortex, all these things, the right and the left brain. I know all these things. I'm like, I want to be able to rewire my brain so that when something happens, I don't associate it with something and make these crazy decisions and behavioral patterns that I have because it worked for me a long time ago. I'm like, I heard about EMDR therapy and I want to try it. And, I said, so I don't want to waste your time. And she was like, well, I don't do it, but somebody here in this office at this behavioral health facility does do it. So I made an appointment and I started today. And so I didn't actually start EMDR therapy today. It was kind of like talking about what it is, getting to know me. But from now on, I'm going to be going once a week to see this therapist who does EMDR therapy. And so what was so awesome is that had I not talked about this publicly, I would have never known about EMDR therapy, and I would have went to that appointment with that lady, and I would have made appointments to sit and talk it out, and the stuff that I've done before that I already know that it wasn't working it was working, but I already know these coping mechanisms and these skills, but I wanted something more. I wanted something to follow, something to rewire my brain, because I understand how brains work. And so I'm so excited about starting this, because I finally feel hopeful. As I've talked about this, I've heard so many other people talk about EMDR therapy, that they've done it, that it worked for them, that they know somebody who worked for, so it just gives me so much hope. And that really just comes down to what I do as my profession is fitness, is that I started talking about what it did for me, what my story was, how it helped me, and how it can help other people. And I made other people believe that they could do it too, and that they could have the great success. And so it's the same thing about anything in your life. You start talking about it, you're going to attract people into your life who know about it or can help you for further along in where you want to go. And so I'm super excited about EMDR therapy. And it's so funny because I watched this show on Showtime called The Affair. It's like the fourth season, and the one main character has been suffering from PTSD for years because her son Gabriel drowned, and she has these visions, and her life just kind of was spiraling out of control as she was dealing with trauma. And so many people don't understand what trauma can do to you and how it can affect so many other parts of your life, your relationships, your work, your health, all these different things. But she ended up doing this EMDR therapy, and I can't remember what it stands for, but anyways, they were doing this thing back and forth, following, something back and forth with their eyes, and it was therapy for trauma. And honestly, I was like, I didn't know what it was. I thought it was something made up that was just in the show, and that is actually EMDR therapy. But this therapist was telling me that that's part of it is the eye movement. But then he has a thing where it's these things you hold in your hand that send out vibrations, and it triggers your right and left brain. And so that's the type of therapy I'm going to be doing as well. So it's so crazy what I've learned on my own, what I'm learning from this book that I'm reading called Unfuck Your Brain, what I've learned, on my own, and what this therapist has taught me just, in our very first session. But I really just encourage all of you who know somebody who might be displaying signs of depression to talk to them, to encourage them so they don't feel alone. And if you are somebody who is dealing with this, that you reach out to somebody for help, for support. And if you've never heard of EMDR therapy and you've suffered from some sort of trauma, definitely look it up and see if there's somebody that can help you get started with the therapy to see if it works for you. One of the things that, somebody was talking about on Facebook today was about, addictions, and that a lot of times the people who suffer, addiction problems are basically people that are suffering from depression or some sort of mental illness. And I think, man, that's so true, because I was telling a friend today when she stopped by, and also the therapist, is that, obviously I did drugs and I drank heavily in a party atmosphere, and I was known as the party girl. But really, to be honest, all the drugs that I did and the alcohol was just what I knew to cope with the pain, to numb myself, to search for happiness, to mask what I was feeling. And a lot of times, my drug use had to do with the fact that things were going on that were uncomfortable, that I didn't understand, that were causing me, mental and, anguish and pain. And so when you do the drugs, you feel this euphoric state, and you can talk about it. You can talk about it without being in your feelings, without losing control, without becoming hysterical. And I felt like I was, able to talk about it and process it better that way. And obviously that's not a good, healthy habit, but that was so true, is that this, drugs and alcohol were really just a coping mechanism I used for a long time. And then I think that since that's been absent from my life, that, I've been searching for something else. And that's why a lot of people, get involved with addictions. And so for me, like, maybe my addiction was, drugs and alcohol became replaced with binge watching, shows, because that just numbed my brain, because I didn't have to think about it, because I could relate to these characters that were, fictional. So, I just want to share my story, because I know so many people have reached out to me privately about how they feel, things that they're going through, things that they're dealing with close friends or family members. And I just want to share with you that you're not alone, and that to spread the awareness about mental health, because there's such a stigma around it that creates this shame, and there's not enough education about it where people can support the other people in their life that are feeling it, or know where to turn or what to do if they start dealing with these same things themselves. So anyways, I'm going to be sharing more as I go along through my EMDR therapy. I'm going once a week, and I'm more than anything, I'm just trying to rewire my brain so that I don't use old coping skills that worked for me as a child or teenager that no longer serve me. And so I hope that I can help some of you guys, and I hope that you guys still share your stories with me, so that I can still have that hope and learn more from your stories as well.